Hello everyone, I'm doing a presentation today on receptor tyrosine kinases and cancer. My name is Ambola Salif, course is Biochemistry 530. Um, Introduction to this course is what is receptor tyrosine kinases? Receptor tyrosine kinases are transmembrane proteins that regulate cell communication. RTKS, which stands for receptor tyrosine kinases, transmits signals from extracellular growth factors to intracellular signaling pathways. They regulate cell growth, proliferation, differentiation, metabolism, migration, and survival. The dysregulation of RTKS is one of the most common molecular abnormalities in human cancers. The notes here is that RTKs are essential for normal cellular homeostasis balance. When mutations or overexpression occurs, signaling becomes uncontrolled, promoting tumor formation, the formation of tumor. Next, we look at the structure and activation of RTKS, the extracellular ligand binding domain, single transmembrane alpha helix, intracellular tyrosine kinase domain, activation process. In the activation process, you have the following that occur. Growth factor binds receptor, receptor dimerization occurs. That is, bunch of receptor comes together. We talk about tyrosine residue become autophosphorylated. Intracellular signaling proteins bind phosphorylated tyrosine. The note here or the essence here is that autophosphorylation creates docking sites for signaling proteins that regulate multiple cellular responses. We look at the next slide, we're going to look at major RKT signaling pathways, important downstream pathways. So the RAS to RAF, which is cell proliferation. We'll also look at cell survival and metabolism. We look at calcium signaling. We also look at gene transcription and immune regulation. Some of the cellular outcomes include increased proliferation, reduced apoptosis, angiogenesis, cell migration, and tumor evasion. RTK dysregulation in cancer. We'll look at some of the dysregulation for receptor tyrosine kinases mechanism. Gene amplification is amplify the gene, point mutations, chromosomal translocations, excessive ligand production, loss of negative regulation, and the result are in continuous signaling with our growth factor stimulation, uncontrolled cell division, and enhanced tumor progression. Examples of receptor tyrosine kinases in human cancer, and the RTK and the cancer type or the form of cancer they cause. Well, we look at the EGFR, the epidermal growth factor receptor. This can be affect the lungs, which is resulting in the lung cancer. We have the HER2 that affects the breast cancer, gastric cancer, and multiple. And we have the VEGFR, multiple solid tumors. We have the PDGFR, gastrointestinal tumors. We have MET as a kind of RTK, and this one causes cancer to the liver, lungs, gastric cancers, and ALT, non-small cell lung cancer. The essence is different cancers are associated with abnormalities in specific RTKs, making them valuable for therapeutic targets. EGFR signaling in cancer, and that is the epidermal growth factor receptor, and that's what EGFR means, epidermal growth factor receptor. Frequently mutated in non-small cell lung cancer, activates MAPK and PI3K signaling, promotes cell proliferation, tumor growth, and metastasis. Common therapeutic targets, elotinin and osimertinib. We're going to look at also next slide, going to talk about the HER and breast cancer. So HER2 amplification occurs approximately in every 15 to 20% of breast cancers, causes excessive receptor signaling associated with aggressive disease, and we have a targeted therapies which includes the trastuzumab and the deruxtecan. Clinical importance: targeted HER2 therapy has significantly improved patient survival. So next slide, we're going to talk about targeted therapy against RTKS and types of RTK inhibitors. Monoclonal antibodies bind extracellular receptors, prevent ligand binding. Tyrosine kinase inhibitors, they block the ATP binding site, which is adenosine triphosphate site, prevent phosphorylation. And the benefits of this, there are a lot of benefits. The benefits of this include precision medicine, improved survival, and reduced toxicity compared with conventional chemotherapy. Challenges and future directions, and we'll look at some of the current challenges, which include drug resistance, secondary mutations, tumor heterogeneity, combination therapy requirements, and some of the future research include personalized medicine, biomarker guided therapy, combination immunotherapy, and next generation kinase inhibitors. At the conclusion, uh, receptor tyrosine kinases regulate essential cellular signaling pathways. This regulation contributes directly to cancer initiation and progression. Understanding RTK biology has transformed cancer treatment. Targeted therapies have improved outcomes for many cancers, and continued research is needed to overcome therapeutic resistance and improve personalized cancer care. And then next we have these are my references uh, with sites and more reading on these topics. Thank you.